Last count caller. Under this government, we have gone from a mental health crisis to a mental health emergency. There are 2,500 children and young people waiting for services with the child and adolescent mental health services. Over 8,500 children are waiting for primary care psychology. Behind each of these figures is a child with a family, a child who is being left behind. When is the government going to provide the early interventions that are key for a child's development and stop failing our children? Since 2017, under Fine Gael and Fianna Fáil governments, there have been 242 children admitted into adult psychiatric services, with almost 30 of these children in the first 10 months of last year. So when is this government going to stop this draconian practice and stop failing our children yet again? Minister, can I ask for clarity from the government as to when the HSE service plan will be released? Many organisations have got in touch with me in the charity sector and are waiting to find out if there will be sufficient levels of funding this year to be able to proceed to provide essential mental health services in our communities. NGOs and the communities they serve need clarity on this funding urgently. The government and the HSE have entered into a surge capacity deal with private hospitals. The deal between the HSE and other private hospitals will allow the health service to use up to 30% of private hospital capacity. Minister, why did your government fail to deliver the same deal when it comes to mental health provision during COVID? I've written to you, Minister, and I've asked you to consider this as a solution that will help with the mental health emergency people are experiencing right now. This will take pressure off our public hospitals who are dealing with the COVID emergency, in addition to providing essential care for people who are suffering with their mental health. The fact is, the people suffering from mental health problems are still arriving at A&E departments as they have no other alternative service to go to. A&E is not the right environment for anybody experiencing a mental health episode. I also want to acknowledge your response to the letter that I wrote you, to the email that I sent you, that you stated that you would investigate the use of this surge capacity for mental health. So, Minister, what stage is this investigation at, and when will this decision be made? Because people need help right now. They need to get access to 24/7 emergency mental health care so they can have the care they need when they need it and where they need it. You mentioned people suffering with eating disorders. But people suffering with eating disorders would benefit from this surge capacity, Minister. Right now, there are only 3 beds in the whole state for eating disorders for adults. The government has failed on its promise to deliver specialist eating disorder teams in each of the 9 CHO areas, and I welcome that you just said in relation to new funding coming down the line next year. But people need the help right now, Minister. Can surge capacity be enabled for people that are suffering from eating disorders? And will you consider that? Funding for mental health as a percentage of the overall health budget has fallen from 16% during the 1980s to 6% in 2019, and was 5.2%. I only got the PQ back this morning. 5.2% last year, and it's fell further again this year. During a national emergency, it is an absolute scandal that the percentage allocated to mental health spending has fell. Sláinte Care recommends 10% of the health budget should go to mental health services, while international best practice recommends up to 16%. The government announced in its budget last year an additional $4 billion for health spending, which was very welcome. But mental health received just 1% of this additional spending. People are sick of the platitudes when it comes to mental health. We are all in this together brigade. It's not washing with them anymore. So when is the government going to put its money where its mouth is and bring mental health spending up to international standards? We're a first world country with a third world mental health system. And Minister, I'll finish on this. Who in the HSE has budgetary control of the funding for mental health? Your programme for government said it would examine the reappointment of a HSE Director for Mental Health. Why has this appointment not happened? I also welcome the news that you mentioned about the monitoring committee for the sharing division. But can I ask, has the implementation committee been set up to implement the 100 recommendations in sharing division? Because the news is that I got back that it hasn't. Minister, mental health is the very definition of a Cinderella service, and without mental health, there is no physical health. Good morning.
Thank you. Minister. Last Cian Corley, will you tell me when?
You have 2 minutes.
Thank you very much. Thank you very much. Deputy, thank you for your questions. You've asked quite a lot there, so I'll try and cover as many as I can, and we'll go back to you in writing for the ones we have missed. Just to say, in relation to, you speak about, I acknowledge the letter that you sent to me in relation to surge capacity in the private hospitals. The HSE has engaged with private mental health hospitals over the period of the pandemic to provide for additional capacity. And I just want to say, the additional capacity includes the purchase of acute beds as well as longer-term care beds that free up capacity in the statutory sector. The HSE has set up a project to provide for 4 cohort of services users in acute units. The HSE has met with 6 different providers in the last couple of weeks, and those plans are being ongoing. But just to let you know, we always use capacity in the private sector as well to supplement the beds that we have. In relation to, you raised issues in relation to CAMHS and the primary care waiting list. In relation to CAMHS, you'll know I secured an extra 23 million in the budget, and there will be 29 whole-time equivalent staff members as a result of that. And I want to tackle the CAMHS waiting list. There has been a significant reduction actually in the Cork-Kerry area in the last 6 months, and I think that should be acknowledged. In relation to the primary care waiting list initiative, I have had several meetings with the HSE and the primary care policy unit, and we are giving consideration to options for developing an intervention to reduce the number of children. I'm very concerned about this list. I met with Minister Donnelly last Thursday in relation to funding, and the work is ongoing to progress the waiting list initiative. You mentioned about children and young teenagers under 18 in mental health facilities for older people. You'll be well aware the figures were well reduced last year, but I have said on the record many times, one child is one too many, and that's something I'm working closely with. We'll come back to you on the rest if that's okay.
Thank you, Minister.